Mr. Ratcliffe, how are you doing today?
I'm good. How about yourself?
Good. It's nice to see you again.
Yeah, likewise.
It's been a minute since our last visit. Do you have any current complaints or anything that's been going on that's different?
No, just coming back in for another assessment.
Okay. All right, great. Well, it's nice to see you again. If you're okay, we're going to go ahead and get started, okay?
Yeah, sounds good.
All right, great. So today we're going to take a look at your head, ears, eyes, nose, neck, and throat. Does that sound okay?
It's a mouthful, but sure.
It is, yeah. All right, I'm going to have you go ahead and stick your arms out for me. I'm going to inspect your skin, okay? And I'm then going to move on to palpate, and you definitely let me know if I hurt you or anything, okay?
Yeah, sure.
All right, do you have any signs or like any concerns with your skin at this point in time?
Skin? No.
Okay. All right, so I'm going to have you hold out your arms for me.
Sure.
Okay, so looks good on visual aspect. I'm going to go ahead and move to palpating the top of you if that's okay.
Yeah.
All right, you feel warm, everything seems intact, temperature is good. Okay, am I hurting you at all?
No.
Okay, so it seems pretty uniform, seems pretty symmetric. Everything appears okay from a visual aspect and from palpation. I'm going to have you turn your arms over. All right, temperature's good. You've been staying hydrated in this hot weather we've been having?
Mm-hmm.
All right,
Doing my
good.
best.
I see you've got a wound here. How did you get that?
From cutting up cars at work.
Okay. All right. Hopefully you were safe beyond that minor scratch, yeah?
Oh, yeah.
Okay, go ahead and turn your arms over for me again. I see you've got tattoos here.
Yep.
Do you have any other tattoos on your arms?
On my arms? Yeah, a couple on my upper arms.
Okay. All right. Have you noticed any issues with those?
Mm-mm.
Okay. Are they pretty old or?
Yeah, they're pretty old.
Okay. I see you've got some calluses and some blisters on your hands also so from work, or were they from rock climbing? I know we discussed previously in our last video.
The rock one.
Okay. All right. Well, everything looks pretty good. I don't notice any wounds outside of that abrasion. It's not, draining or anything. It looks like it's healing appropriately.
Mm-hmm.
I see you right on your hands.
Yeah, sure.
That's a heck of a habit.
Yep.
All right. I know it is. But permanent marker really remains there.
Yeah, that's the point.
Fair enough. Okay. Well, everything looks distributed appropriately. Everything looks good on your skin so far on your upper extremities. Go ahead and extend your legs for me. Noticed any wounds or anything of that sort on your legs?
No, just a minor scrape and bump.
Looks like from rock climbing as well?
Yep.
Okay.
And work.
All right. From visual aspect, it does appear you've got some scattered abrasions. I am going to go ahead and feel, okay?
Sure.
Does everything feel okay there?
Yeah.
Okay.
Sorry.
Temperature's good. Cool, dry, and intact on your legs outside of those scattered abrasions. I am going to pull on you a little bit. I want to look at your elasticity of your skin.
Sure.
Okay. Turner's good. Elasticity is good. I'm not hurting you, am I? Pinching you. All right. And your hair's distributed appropriately on your legs, on your arms as well. You have no other concerns with your skin?
No, ma'am.
All right. Skin on your face looks pretty good. All right. All right. Well, if it's okay with you, I'm going to grab some gloves and we're going to continue on with the rest of our assessment. Is that okay?
Yeah, sounds good.
All right. Perfect. Let me grab some gloves.
Sure.
All right. Got some gloves here. I am going to take a look at your hair next. Is that okay?
Yeah, it's fine.
All righty. So I'm going to slap on some gloves here. All right. I'm just going to feel through your hair, okay?
Sure.
All right. You noticed any concerns with your hair?
Not at all. I mean, hairline's falling back a little bit, but
Okay.
it's expected.
Hair's blonde. I don't see any gray hairs yet. I'm sure that's reassuring.
For now.
Remind me how old you are.
27.
Okay. Yeah, your hair seems evenly distributed. The color's blonde. Pretty dry. No texture issues. I think it's okay. I don't feel any bumps on your head either. Looks like it's distributed appropriately, like I said. Do you have any concerns with your hair at this point in time?
No, not at all.
Okay, great. I'm going to have you hold out your hands here. I'm going to take a look at your nails and your nail beds and all that, okay?
Sure.
Alrighty. Length of your hands look good. Nail beds look good. Pigmentation's good. I am going to squeeze your finger. I want to make sure capri feels good. Perfect. Are you a nail biter?
Yep, sure am.
I see that. Alright, go ahead and flip your hands over. Okay, I see you have a blister on your palm, some scattered calluses. Most likely from the rock climbing like we discussed earlier.
Yep.
Okay, go ahead and flip them back over for me. Your skin's pretty thick on those hands too. It must be built up from all that rock climbing, huh?
Yep, working out and such.
Yeah, alright, I'm gonna take a look at your cuticles. They look good and appropriate. Looks like you have a little bit on those pointer fingers.
Yeah, I guess so.
Yeah, okay. Nail beds look great. Not blue, no cyanosis. Looks great. Do you have any complaints about your fingers? Okay, so no swelling, no redness that we've noted to your nail bed. Cuticles look great, texture's good. Thickness is a little tougher on those hands, but you are pretty hand heavy in your job, yeah?
Yeah, very much so.
Okay, all right, we're gonna move on to the next portion of the assessment if that's okay with you,
Yeah,
okay?
sounds good.
All right, perfect. Alright, Brennan, we're gonna go ahead and move on to the head and neck portion of our exam, okay?
Alright.
Alrighty, so we're going to look at a lot of things with your head and your neck. I'm gonna look at symmetry, make sure that there's not any abnormalities, okay?
Yeah.
Alrighty, so from this angle, I see that everything looks okay, looks pretty symmetrical with the rest of your face. If you could look at me head on, perfect. Any issues that you've noted with your head or neck?
Mm-mm.
Okay, so I did notice that your head was symmetrical, throat, neck is symmetrical. You're not having any concerns, is that correct?
Besides the ear pain, but are you gonna get to that or?
Yep, I'll get to that.
Okay.
Yep. No trauma, no issues with lesions, no wounds that I've noted on your head or neck. All right, perfect. So I am gonna go ahead and move on to the palpation of your face. Please let me know if I hurt you, okay?
Gotcha.
All right, and I'm just gonna palpate. Any pain? Okay. Don't feel any abnormalities, no crepitus. Okay. No pain, right?
Nope.
Okay. Okay. Don't feel any abnormalities, no bumps, no masses, no lumps. Okay, and that felt okay to you?
Yeah.
Okay, so I am going to take a look at your scalp, make sure it's symmetrical, no tenderness. I want to ensure that your hair texture, color, and distribution is appropriate, which we did discover that in our previous assessment. Just want to double check my findings.
Sure.
Okay, everything looks good there. Look at me. Perfect. All right, everything looks symmetrical. All right, we're gonna go ahead and move on to your neck, okay?
Okay.
I'm going to go ahead and feel your trachea and your thyroid. If this causes any sort of pain to you, please let me know.
Yeah,
okay?
you got it.
All right, so I am going to go ahead and feel on your trachea if you kind of want to extend your neck out. Perfect. I'm going to go ahead and just palpate your trachea. Okay, don't feel any bumps, no lumps. Go ahead and swallow for me. Perfect, okay. So I am going to go ahead and move around you. I'm going to go ahead and feel that thyroid, okay?
Okay.
Okay. Feels good. Appropriate size, appropriate shape, appropriate configuration. Go ahead and do me a favor, swallow again. Perfect, okay. I am going to move on to your lymph nodes, is that okay?
Yeah, that's fine.
Okay, so I am going to feel a little bit all around, okay? So just don't feel, make sure you tell me if there's any pain, okay?
Sure.
All right, I am going to go ahead and move on to the pre-auricular and then the post-auricular, okay? So I am going to feels good. Any tenderness? Okay, any tenderness?
Nope.
Perfect.
I do have that one enlarged here on the side of my neck.
Oh,
I forgot to tell you about it, so.
okay, where did you have that finding at?
I've had it all my life. I just didn't want you to freak out.
Okay, I am going to feel occipital. Okay, good. Oh, I do feel that. Okay.
Yep, and one there too.
Yeah, okay. Did you have that found like on a physical when you were younger or?
I don't remember. I just always remember having it.
Okay. All right, I am going to go submandibular and submental, okay?
Okay.
Okay, feels good. That's interesting. Thanks for pointing that out. That's a really good catch. Have you ever had issues with that prior? Okay. I am going to feel your anterior deep cervical. Okay. And I am going to feel down here. Okay. Does that feel any painful to you? Okay. How about when you're sick? Do those ever, get
Swell
inflamed?
Up. Yeah, they swell up a little bit.
Okay. More in like your supraclavicular area or more in like your...
It might, honestly, I only noticed this one. On the
Okay.
side of my
And
neck.
it's only that one?
Yeah.
It's really interesting. Okay. I am going to go ahead and move to grab my stethoscope. I am going to go ahead and listen for some bruise, okay?
Sure.
Okay. Alright, got my stethoscope here. I am going to go ahead and take a listen, okay?
Sounds good.
Alright, so first I'm going to listen to your temporal artery for some bruise, okay?
Okay.
I'm going to go both sides.
Alright.
So just make sure you stay still. Okay. Okay. Both sound great, no significant findings there. I am going to go ahead and press my bell over your eyes. I'm also going to listen for bruise there, okay?
Alright.
Alright, go ahead and close your eyes for me. that's a little bit uncomfortable, isn't it? I apologize.
It's okay.
Okay. No significant findings there either, which is reassuring. I am gonna go ahead and look at your thyroid for birds as well, okay?
Sure.
Okay, perfect. No significant findings there either. I am going to go ahead and palpate, it's called your temporomandibular joint. I am going to take a look at that. I want to make sure that there's no anything like abnormalities or crepitus, okay?
Okay.
So I am going to go ahead and open your jaw. Okay, good. That feels good. Okay, go ahead and close. Perfect. No crepitus there, no abnormalities. Was that tender at all?
Mm-mm.
Okay. All right. Well, that looked great. I'm also going to move on to your eye examination. How does that sound?
Sounds good.
Okay, I'm going to go ahead and grab the things that I need. Alrighty, Brendan, I've got a Snellen eye chart test that we're going to go ahead and start with, okay?
Sounds good.
So, kind of like your typical eye doctor test, I'm going to kind of stand to the side of you. I want you to do both eyes, left eye, and then right eye, okay? And I know from our previous video, you've just recently gotten LASIK, correct?
Yep, sure did.
Okay, and we are about 2 weeks post-op from that, if I am...
Roughly, yeah.
Okay. Alright, so go ahead and we'll do both eyes first.
Okay.
Go ahead and read the lowest eye that you can, or lowest line that you can, okay?
Yeah, bottom one, LTFPH.
Oh, perfect, okay. Alright, go ahead and cover your left eye.
Okay.
And same deal.
Same. Just as clear, LTFPH.
Perfect, okay.
Right?
Yep.
And same, LTFPH.
Perfect, okay. Those LASIKs are really doing favors for you, yeah?
Sure are.
Okay, perfect. Alright, we're gonna go ahead and move on to what I call the confrontation test, okay? So it's kind of, you're gonna cover one eye and I have to hold up some hands with some fingers on it and you're gonna tell me how many, okay? So I'm actually gonna give you this so that you can't cheat.
Alright.
Okay. So I'm going to stand a little bit off to the side of you.
Okay.
Okay, go ahead and cover your right eye, perfect. Alright, look straight ahead. I'm gonna hold up my hand with numbers on it, or fingers with numbers on it, and let me know what you see, okay?
Okay. 3.
2.
2. I'm not sure. 1.
Perfect. Okay, I'm gonna go off to the side of you, okay?
2.
Perfect.
1.
Okay. Go ahead and cover your other eye. Alright, stare straight ahead.
2. 1.
Okay, I'm gonna go off to your left side, okay?
4. 2. 1.
Perfect. Okay. Was that difficult for you at all?
Not really.
Okay, alright. So we are going to go ahead and move on to the inspection of your eyes. I'm also going to be palpating after I'm done inspecting.
Yep.
Do you have any concerns that you want to bring forth before I get started?
I'd say just be careful. I just got that surgery.
Okay. Alright, so I am just going to take a look at your eyes and your eyebrows. Alright, everything looks symmetrical and appropriate. I am going to go ahead and measure and ensure that they're both the same length. Okay. Good. Alright. I am going to go ahead and palpate your orbital area, okay? And let me know if there's any pain. Any pain there?
Nope.
Okay, how about above? Trying to be careful, I know you just recently had that surgery.
Yeah, nope, nothing there.
Okay, alright. Go ahead and open your eyelids. Yep, open as wide as you can and close them tight. Squeeze. Okay. Painful there at all? Okay. Alrighty, I am going to go ahead and take a look at your conjunctiva and your sclera. Kind of look up for me. Alright, I am going to pull up and down, okay? Alright, sclera is red. Not dry, intact. I don't see any wounds, nothing to your eyeballs. Everything looks great there, especially post-LASIK. What did your eye surgeon have to say after your LASIK?
Yeah, no problem.
Everything went pretty well then?
Yeah.
Okay, alright, great. Well, your corneas look great. Go ahead and look up for me. Look down, look to your left, look to your right. Okay, great. Alrighty, so I am going to go ahead and put my hand up and I'm going to move towards your face. I want to ensure that your eyes respond appropriately, okay?
Okay.
Alright, great response. Alright, close your eyes again. Open them. Alright, brisk pupil reaction is great. Alright, perla is noted. Okay. Alright, so I'm going to go ahead and take a look at your lacrimal gland as well.
Sure.
Alright, it's appropriate, no swelling, moisture tact. Okay. Is that painful at all for you? Okay. Alrighty. Do you have any questions for me?
No.
Okay. I am going to take a look at your eye with my pen light here.
Okay.
I just want to make sure that your pupillary response is appropriate, your corneals are reacting well, and there's appropriate cardinal fields of gaze, okay? Alright, so I am going to, in front of you. Good. 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 Pupil response is brisk. Alright, open your eyes wide for me. Good. Vision's intact, no complaints there. Okay. Say pupil measurement is about 3 millimeters, I'd say. 3 mm. Okay. Alright, both are equal in shape, brisk reaction. So no complaints there, yeah?
No, ma'am.
Okay. Alrighty. Well, we're gonna go ahead and move on. I am going to grab my ophthalmoscope, but I can't ever say that word.
Yeah, that thing.
The light thing, the
Yeah.
ophthalmoscopic light. I'm gonna go ahead and take a look, okay? I'm gonna look at your lens. I'm gonna go ahead and look at your reflex, your retinal color, blood vessel characteristics, all of that good stuff, okay?
Alright.
Alrighty. So I'm gonna kind of pull up on your eye, okay? Good. Alright. Good. Everything looks good. Alright, normal disc characteristics, normal macular characteristics. I don't see anything of abnormality, which is good, especially post LASIK treatment. I'm going to ask you to look directly at the light, and I just want to make sure that your depth of your anterior chamber and your macular characteristic is appropriate, okay?
Alright.
Good? Good. Alright, I don't see any enlarged blood vessels. Everything looks appropriate. Yeah, everything's acting appropriate. Good. Alright. Well, sounds good. It looks like we'll move on to go ahead and move on to your ears portion of the exam. Does that sound okay to you?
Sure.
Alright, I'm going to go ahead and grab my supplies. Alright, like I said, we're going to move on to your ears, okay?
Okay.
I'm going to look on the internal, external. We're going to do a couple tests to assess your hearing, okay?
Sounds good.
Alright, so I am going to start with your left ear. I'm just going to look at the external portion of it yet, okay?
Okay.
Okay. Looks good. Looks good in shape, no wound. You have your ears pierced.
Yep.
Okay, gonna move on to this side. Good. Alright, I am gonna stand in front of you. I just want to ensure that they are symmetrical. Okay. Any pain there? Alright. No abnormalities there, no crepitus, no bony deformities, nothing of that sort. I'm gonna palpate around your ear. No pain there?
Nope.
Alright. I don't see any drainage from your ears. Do you have any hearing complaints currently? Alright. Just repeat after me. You can't teach an old dog new tricks.
You can't teach an old dog new tricks.
Okay. Have you had any complaints with your hearing lately? Okay. Should I ask your wife?
Maybe.
Okay. Alright. So we are going to go ahead and move on to the inner portion of your ear, okay?
Okay.
Alright. I am going to take a look inside. Alrighty. I am going to pull back on your ear so that I can appropriately look, okay?
Sounds good.
Okay. Alright. Alright. Tympanic membrane looks great. I am going to go ahead and turn this upside down so I can better assess. Tympanic membrane looks great. I do see a little bit of earwax here build up. But nothing that you can't fix. We're just cleaning out your ears a little bit better, okay?
Alright.
Alright, and I don't see any like foreign objects, no abnormalities there besides that earwax, okay? Alright, I am going to go ahead and look in your ear canal as well over on this side.
Sounds good.
Okay, looks great. Pull up and back, looks good. Alright, I am gonna go upside down again so that I can better see. Alright, looks good. Same over here, just a little bit of earwax buildup. This is the ear that you've been having that pain in, right? From our last visit, you had mentioned that you wake up with that pain in your ear, correct?
Right. Yeah.
Okay. How has that gotten over the past few weeks?
It hasn't happened since. Like I said, it's really rare.
Okay.
Almost never happens, but when it does, it's painful.
Okay. Well, in your ears, everything looked great. There was no abnormalities like perforations, any foreign bodies, anything of that sort. So everything looked good. External looked good. We've discovered your hearing as well. I am going to do a couple tests. One is called the Weber test, and then the other is called the Rhine test. I have my fancy tuning fork here. Have you ever seen this before? I know you mentioned that you're a paramedic, so.
Far beyond our scope.
Okay, fair enough. So what I'm going to do is I'm going to tap it on my hand, and it makes this interesting vibration that you're going to feel, and you're going to tell me when you feel it, okay?
Okay.
All right, you ready?
Yeah.
First one is going to go on the top of your head. Anything?
Nope. Supposed to feel it vibrating?
Mm-hmm.
No, I don't feel anything.
Okay. All right, we're gonna go ahead and move on. I'm going to go ahead and put it on your mastoid process, and then it's going to go ahead and go in the front of your ear, okay?
Okay. Nope. Feel it there.
Okay. Let me try on this side again.
Yeah, there we go.
Okay.
Feel that.
All right. I'm gonna go in the front of your ear, okay? Feel it here?
Nope.
I'm not getting a good.
There we go.
Okay.
Yep.
Did you hear it?
I did not know. I think it stopped vibrating.
I'm not hitting it hard enough. Like it's like keeps hitting the palm of my hand. Sorry.
You're good. Yep, I hear it. Yep.
Okay. All right. Sorry, I kept hitting the wrong portion of my hand.
It's okay.
Alrighty, I am going to go ahead and do what we call the whisper test. So I am going to kind of stand over here in front of you. I'm going to have you cover your left ear.
Okay.
Or I'm sorry, your right ear. Go ahead and cover your right ear. And I'm going to go ahead and look away from you, and I'm going to whisper something, okay?
Baseball.
Perfect. Go ahead and cover your other ear. Same deal. I'm going to kind of whisper, okay?
Baseball.
Good. Okay. All right. So hearing's good, it appears. Do you have any other concerns that you want to voice right now? All right. So we are going to go ahead and move on to your nose. This will be the last portion of our exam. It'll be your nose, mouth, and throat. And then we'll be done. Okay?
Sounds good.
All right. I am going to take a look at your nose, inside and outside. Inside, I'm just going to look at your nares, your mucosa, ensure that everything is aligned appropriately, no discharge, no perforation. Okay?
Okay.
All right, so I am going to take a look at your nose here. I'm going to inspect and palpate. So upon inspection, everything looks great, it's symmetrical. Let me know if this is painful. Okay, feels okay? How's that feel to you?
Good.
Okay. Have you ever broken your nose before?
Probably.
Yeah,
I
okay.
think so. I've never been x-rayed for it.
Okay. Well, I didn't feel any bone or cartilage displacement, no masses on your nose, so that's good. I am going to go ahead and kind of push up on your nose because I want to look inside your nose and ensure that your mucosa is appropriate. There's no discharge from your nose, no foreign bodies. I would hope that you know if you have any foreign bodies there, but just want to ensure, okay?
All right.
All right, I'm going to push up. I'm going to put my light here. Everything looks good there. Good. Go ahead and take a sniff for me, and then out. Okay, good. I don't see any abnormalities there. There's no discharge, no swelling, no perforations. Everything is appropriately aligned. Color looks great. I am gonna go ahead and take a look at your mouth and throat, okay? So I kind of just want you to smile for me. Perfect. Skin looks appropriate on your lips. There's no adhesions, there's no lacerations, nothing of that sort. Your lips are chapped, not chapped. They're moist in inspection. Look good. Okay, go ahead and smile for me. Show teeth. Okay, no cracked teeth, which is good. All right, your teeth look nice and white and healthy. Good deal. All right, I'm gonna go ahead and have you stick out your tongue for me. Okay, good. All right, looks appropriate. No lesions. Wet mucosa is appropriate. I'm gonna go ahead and look at your buccal mucosa and your gingivae. We've established that your teeth are appropriate. There's no occlusions, no caries, no loose or missing teeth, no surface abnormalities. So go ahead, I'm going to go ahead and have you open your mouth, and I'm gonna kind of just take a look in your mouth, okay? Good, appropriate, good, good. Go ahead and stick your tongue out and say "aw." Alright, your tonsils look appropriate. You still have your tonsils, I see. You're not one of the many kids who had to get them taken out.
Right.
Your uvula and your palate looked appropriate. No drainage, no wounds, no white chalky substance on them, which is great. I think that we are going to be okay. I am going to elicit a gag reflex.
Okay.
And then there was a gag reflex, which is appropriate. Good deal.
Yep.
All right. It seems like we've covered all of our bases. Do you have any other comments or concerns or anything else that we need to go over?
No, not at all.
All right. Well, that was great. Thank you for your time. I appreciate it.
Yeah.
And I will document all of our findings, and I hope you have a good rest of your week, okay?
Thank you, you too.
All righty.